Bom dia. Thank you for having me back again to speak to you on this perioperative education series. Today, I will be talking about perioperative pressure injury prevention with a focus on the assessment portion of the prevention strategy. A little bit about myself. I have been a nurse for 21 years. 16 of those years have been spent in perioperative areas caring for patients undergoing the surgical process. I have experience in pre-op, the post-anesthesia care unit, the medical surgical ward, and in the OR suite. In addition to my love for being part of the surgical team, I am also passionate about sharing knowledge with others, which is why I obtained my Master of Science in Nursing with a focus on nursing education. You may also notice that I actively participate in each chapter of ARN. I'm the Vice President of ARN of San Diego County, and I'm currently serving on the National Nominating Committee for AORN. As Jerry will share with you, there are many reasons why we are especially watchful for pressure injuries in the United States. The effects of this preventable condition have far-reaching financial, legal, and quality of life implications. It is our role as perioperative nurses to implement the best evidence-based strategies to protect our patients and organizations. The best practices for perioperative pressure injury prevention include implementing perioperative pressure injury prevention programs or bundles, creating multidisciplinary teams to develop and implement policies and procedures, incorporating proven products and protocols into patient care, providing continued education to staff, and using validated and reliable risk assessment tools for perioperative patients. As you have heard, ELPO is one of the validated tools that can be utilized to assess for risk resulting from surgical positioning. I will be providing a brief overview of the Monroe Scale, Scott triggers, and PRAMs. The Monroe Pressure Risk Assessment Scale is another tool designed to evaluate the risk of pressure injury development in patients, particularly in surgical settings. Here's an overview of its key features and how it functions. The Monroe Scale was specifically developed for use with surgical patients. It recognizes that the risk factors for pressure injuries in a surgical context might differ from those in other healthcare settings. For example, the duration of the surgery and the type of anesthesia can significantly influence the risk. This scale includes unique factors related to perioperative care, such as the length of the surgery, the patient's positioning during the operation, and the type of anesthesia used. These factors are critical because they directly impact blood flow and tissue integrity, which are crucial in the development of pressure injuries. Like other scales, the Monroe Scale assigns a score to various risk factors. The total score helps determine the level of risk for pressure injuries, guiding preventative measures that should be implemented. By focusing on the specific conditions of surgical patients, the Monroe Scale helps perioperative nurses and other healthcare professionals implement targeted interventions to mitigate the risk. This could involve adjustments in patient positioning, using specialized support services, and managing the duration of immobility both during and after surgery. The Monroe Scale is valuable because it addresses the distinct needs and risk factors associated with the perioperative environment, aiding in the focused prevention of pressure injuries in patients undergoing surgery. The next validated tool we will discuss is PRAMs. The perioperative risk assessment measure for skin, developed by nurses at the Cleveland Clinic, is a specialized tool designed to assess the risk of developing pressure injuries among surgical patients. PRAMs evaluates several key factors, including age, with a threshold of 70 years or older, presence of diabetes, any pre-existing pressure injuries, history of surgery during the same hospital admission, a Braden scale of 16 or less, and surgical duration of 5 hours or longer. These factors were chosen based on their proven association with increased vulnerability to skin integrity issues during the post-surgery. By integrating these indicators into a scoring system, PRAMS helps perioperative healthcare providers identify patients at high risk, enabling targeted interventions to prevent pressure injuries. This tool is invaluable in clinical practice, not only for its predictive capability, but also for its role in enhancing patient care by guiding preventative strategies tailored to individual risk profiles. The last tool I will discuss is the Scott Triggers Assessment Tool. Developed by Susan Scott, the Scott Triggers Assessment is a proactive, evidence-based tool designed to identify surgical patients at high risk of developing pressure injuries. This tool considers a range of critical factors, including age, serum albumin levels, body mass index, American Society of Anesthesiologists score, and duration of surgery. The Scott Triggers system operates through a multi-step process that begins with thorough visual skin assessment, followed by calculation of the Scott Trigger score. A patient is considered high risk if they meet 2 or more of the following criteria: age 62 or older, serum albumin below 3.5 grams per deciliter, BMI under 19 or over 40, a SACE score of 3 or higher, or a surgery duration exceeding 3 hours. High-risk patients are then managed with specialized OR skin bundles, which include preventative measures like prophylactic dressings and pressure support surfaces. This approach is discussed during pre-operative briefings and includes post-operative assessments to ensure continuity of care. Utilized in 36 states across multiple hospital systems, the Scott Triggers tool has demonstrated a significant return on investment by reducing the incidence of hospital-acquired pressure injuries in surgical patients, underscoring its effectiveness and importance in clinical settings. Assessing the risk of pressure injuries in pediatric patients and those with darkly pigmented skin requires special considerations to ensure accurate and timely identification of at-risk individuals. In patients with darkly pigmented skin, early stages of pressure injuries, such as non-blanching erythema, can be challenging to detect due to the subtlety of redness on darker skin tones. Therefore, healthcare providers must employ additional assessment techniques, including the evaluation of skin temperature, edema, induration, and pain, which are crucial indicators of tissue damage. Long-wave infrared thermography can also be utilized to measure temperature variations indicative of changes in skin perfusion, providing a non-invasive method to distinguish well-perfused tissue from compromised areas. In pediatric and neonatal patients, the risk assessment must account for differences in anatomy and skin integrity. Infants and toddlers, for example, have a higher risk of occipital pressure injury due to their relatively large head size compared to body size when in a supine position. The immature and thinner epidermis and dermis of neonates makes them particularly susceptible to skin and pressure injuries, although their skin may be more resilient to pressure and shear compared to older adults due to their higher levels of collagen and elastin. Nutritional status is another critical factor, as neonates and children have increased nutritional needs to support growth, yet they are more prone to deficiencies because of smaller appetites and dietary intake. To improve accuracy in predicting risk, structured pediatric risk assessment tools such as the Braden-Q scale, the Braden-QD scale, the Braden-Q&P scale, the Glamorgan scale, and the neonatal skin risk assessment scale should be employed. These tools are tailored to reflect the unique susceptibility profiles of pediatric populations, ensuring that preventative measures can be properly targeted and implemented. I hope you've learned a lot from this presentation of various risk assessment tools and considerations. Here are some resources for you to find more information. Feel free to contact me for a full list of references. Obrigada. I appreciate you for allowing me to share this information with you. To safeguard the well-being of patients who have entrusted their care to us, let's commit to applying the best strategies we can find for providing safe, high-quality perioperative care.